In today's aesthetic medicine, we're tackling an embarrassing problem, rosacea. Red blotches on your face that look like blushing but never seem to go away. Well, here with the latest advances in rosacea treatment from aesthetic medicine is Dr. Jerry Darm, along with one of his patients, Michelle Young. Nice to have you both here. Dr. Darm, let's start with this, and don't call me honey.
Good morning, honey.
Yeah, don't call me honey. Let's start with this, dear. What is rosacea?
Rosacea is the redness that occurs. It's in a butterfly pattern on the cheeks and the forehead and the chin.
Is it only on the face, or can it be in other parts of the body?
Actually, it can go to the neck or the chest, but mostly on the face.
And Michelle, you suffer with rosacea all your life. Tell us about it.
That's correct. When I was younger, if I exercised as a kid, I'd be the kid that had the really red face. And it was a little embarrassing. As I grew older and older, it just kind of progressively got worse. Until I was in my mid-30s, and it actually started becoming painful.
Is that common, pain?
Not too common, but it can occur, and it becomes really disabling at that point.
I would imagine a lot of people try topical ointments and creams.
There are topicals, and they help with the pustules and the papules. Rosacea can sometimes be confused with acne. In fact, it's called acne rosacea by some individuals.
Is it always present, or does it come and go in the face?
Comes and goes, and especially with the flushing. In other words, glass of red wine, heat, cold can always. Here's a
case
of real severe pustular rosacea, and this cleared beautifully with this particular patient.
So, Dr. Darm, let's talk about the treatment. Here's another startling comparison. What kind of treatment are you using then to get the results that we see in the show?
We're using really advanced treatment that includes intense pulse light and radio frequency, which helps with the flushing, the redness, the papules, the pustules, and in Michelle's case, the pain was resolved.
And how many treatments did you go through?
I've had 6, and over the course of 2 years, so gradually, and actually the pain was reduced after the very first treatment. And gotten progressively, like I said before, better treatment. So.
And is the treatment permanent, or do you have to go in for maintenance?
No, in 3 to 5 years she'll need to come back for touch-ups. But it's known as the Celtic curse or the Irish roadmap. Some people call it.
Is it more of a Western European?
It's hereditary.
Oh, is it really?
Yeah.
All right, and so now your past treatment. Obviously, I don't see any signs of rosacea. What difference does that make in your day? You must be thinking, why didn't I do this when I was 20?
Well, the reason I didn't do it when I was 20 was I didn't really know what I had. It took a while for me to self-diagnose, since the insurance doesn't pay for it. Typically don't diagnose it for you. And by the time I figured it out, I had 4 kids, and it was not on the top of my priority list. So until I started having the pain, then it got bumped up.
Well, fascinating information. Well, folks know that Dr. Darm will be providing free consultations at the Portland Bridal Show. That's coming up on the weekend of January 15th and 16th at the Oregon Convention Center. For more information about aesthetic medicine, Dr. Darm, give him a call, 503-697-9777. Just don't call him honey.
Thank you, dear.
Good to see you. Thanks, Michelle.
Thanks.